how's it going counseling for our presentation this week? So first just wanted to give an overview of what our presentation is going to be covering. So first we're going to go over what is career counseling. We're going to cover what types of interventions you would see in career counseling, what the treatment goals would look like, and some theoretical orientations, and just some fun info on the history of career counseling as well. And then next, Anoushka is going to discuss the relevance of career counseling to the mental health counseling field. As clinicians, how can we use career counseling as an intervention, and how is it relevant to us? And then Anoushka is also going to discuss some career counseling assessments that are helpful if you decide that you are interested in further pursuing this as an intervention. Just different assessments that go along with that. These are assessments that are empirically validated and supported as well. And then the next part that both of us are going to talk about are population-specific considerations. So we're going to talk about specific considerations in career counseling for different groups. So we're going to cover LGBTQ plus individuals, disabled individuals, older adults and retirees, disabled individuals, and adolescents and young adults, as well as diverse and multilingual populations. And then next, we're going to talk about some helpful resources as clinicians, for clients and families as well. And we are going to wrap up our presentation. So let's get into it. So what is career counseling? So career counseling are services that clinicians offer to address presenting problems around work. Career counseling is not just looking at job-related concerns, but also how cognitive, behavioral, and emotional difficulties may contribute to work. So for example, we see a lot of clients who have diagnoses such as depression, having a hard time getting stable employment, or have a lot of difficulties maybe being motivated to work. So we're helping them with job skills, but we're also helping them target those core beliefs and anything that may be standing in the way as a whole from getting into work. So an example of something that from a CBT approach that you might see with career counseling is providing career counseling and CBT to a client diagnosed with depression. So as a theoretical model, career counseling intertwines clinical practice, research, and social justice. And what I mean by that is the theories in career counseling suggest that work behaviors exist that can be studied and applied to clinical practice. And it also integrates social justice to conceptualize how diversity impacts career experiences, such as through policy and privilege. So for example, career counseling considers the different diverse populations and how different diversity factors may play into a role. For example, we know that individuals of racial and ethnic minorities often have greater levels of discrimination, which then in turn can often make it harder for them to find employment, and at the same time, in jobs, they are likely to experience discrimination in the workplace, which may prevent them from getting paid fairly for the work that they're doing. And they are also less likely to be chosen for promotions and job growth. So looking at all of those factors as well. Who provides career counseling? Often master's level clinicians provide career counseling. They often have additional training in career issues. This is often seen in private practice, residential, and school settings, but this can be done anywhere that is relevant to your practice. And at the doctoral level, there are several different types that specialize in career counseling, such as vocational psychologists and industrial and organizational psychologists as well. So how did career counseling come to start? There is documented evidence that discussions of career and how it relates to wellness and psychology has existed for centuries. Scholars suggest that career counseling books have existed as early as the 1400s. Of course, it is not career counseling as we see it today. And philosophers have discussed the importance of work and its relation to wellness from the BC era. Um, Career counseling more formally became a field in the 1900s, pioneered by an individual named Frank Parsons. So Frank Parsons was a social reformer in Boston who provided vocational services to underserved populations. In his conceptualization, he created a three-step formulation in this venture, which has since served as the foundation for modern career counseling. And if you look at the graphic below, this outlines his three-step formulation. And on the next slide, we're going to go into more modern theories that are often applied to career counseling as well. But this has been something that is very foundational to the continued growth of career counseling as a whole. The first step is personal attributes. So this suggests that our personal attributes, who we are as a person, our thoughts, our beliefs, our self-efficacy, all of those things tend to impact the job that we choose or the work that we do. And then the next step in Parsons' formulation is vocational knowledge. So this is what we know about our job. These are our job skills. This can be things like soft skills, hard skills, or any specialties that you might have. And then the next step in this formulation is the use of reasoning to integrate personal and vocational constructs to come up with a career that is of best fit to you, and that one is doing a career field that also promotes wellness as well. So next, as I was discussing previously, since its origin, other theories have been applied to career counseling. So one of them that has been found in career counseling literature are some of the theories from Maslow, particularly around self-actualization and the hierarchy of needs. So we're thinking about the hierarchy as needs. Career counseling has often related work to being as a needs fulfillment. It's something we need fulfillment in our lives, and work is a means that we can achieve that with if we're choosing the right profession that aligns with our values. And the next part is work to fulfill security, social esteem, and actualization needs. So that means choosing a career that is consistent with who you believe yourself to be. And the theory here is that if you choose a job that does not align with those things, it can decrease the wellness and your overall satisfaction. And then there have also been a lot of application of Bandura's theory of self-efficacy and some theories from a scholar who particularly studies career counseling, which is Super and colleagues. So these theories suggest that work is an expression of personal identity. And then applying Bandura's concept of efficacy expectations, we can increase ours as well as our clients' efficacy expectations through job choice, and choosing a career that matches your efficacy expectations and being successful in those roles are likely to increase your efficacy expectations. And then when we talk about different considerations for populations, The third theory that we often see applied to career counseling is cognitive behavior therapy. So this looks at how cognitive behavioral constructs impact work and roles. And so what I mean by cognitive behavioral constructs are the things like thoughts, emotions, behaviors, core beliefs, those types, and schema, those types of things. So if we're looking at we think about the cognitive triangle, we look at how thoughts, emotions, and behaviors are interconnected and influence one another. And changing one area of the triangle will lead to positive and adaptive changes in other parts of the triangle as well. So this really places the cognitive triangle in the context of the workplace, not just at work, but also different factors that might contribute to difficulty in the workplace. I'm going to pass it off to Anoushka, who is going to discuss the relevance of career counseling to the mental health field and some assessments for career counseling.
So in terms of career counseling's relevance to the mental health field, many clients present to therapy with mental health concerns as well as career and vocation related issues. And so these concerns may not only co-occur, but they're often interrelated and may even exacerbate one another. For example, depressive symptoms are associated with increased absenteeism and lower workplace productivity. But at the same time, symptom presentation itself may be worsened by workplace stressors. There's also some evidence to support a bidirectional association between the quality of one's vocational life and mental health, in that low job satisfaction is tied to poor physical and mental health outcomes. On the flip side, psychosocial impairment and distress is tied to greater absenteeism, lower workplace productivity, and lower work performance. And so, in this context, it's clear that mental health concerns and career issues are interrelated. And so, in the interests of best supporting clients' overall functioning, it's important to be addressing both in counseling. In a related vein, issues relating to career and employment may also affect a client's ability to meet basic needs, which in turn negatively or may negatively impact their overall well-being, of which mental health is a part. For example, a client that lacks stable employment may find it difficult to pay for groceries, pay for rent, and even show up to session. And so again, to best support the client, important to be attending to career issues in conjunction with strictly mental health concerns. Career and vocation may also play a key role in treating certain clinical disorders. For example, in the treatment of substance use, a critical feature of treatment often relates to helping the client create or reorganize their life around activities that do not involve substance use. And finding and maintaining stable employment may be just one of those activities. Similarly, in the context of individuals living with serious mental illness, individuals who are employed reported greater self-esteem, higher quality of life, and fewer psychiatric symptoms in comparison to those who were unemployed. And so here, career counseling may also help improve clinical and treatment outcomes. So in terms of career counseling assessments, there are quite a few available, but I'm going to be focusing on some of the more commonly utilized ones. And so to start, we have the Holland Code assessment, or the RIASEC. This assessment is based on John Holland's theory of career choice, which suggests that an individual's personality has a strong bearing on their choice of occupation or career, and that individuals are more likely to be satisfied working in occupations that align well with their personality type or types. And so, based on this idea, Holland identified 6 different personality types, each with their own set of characteristics, traits, and associated interests. And so we have realistic, investigative, analytical, social, enterprising, and conventional, which is what RIASEC stands for. And if you look at the graphic on the bottom left-hand corner, this gives us an idea of what these personality types are all about. So as an example, someone with a dominant realistic personality type likely is quite practical and logic-minded, enjoys hands-on application-based work, and perhaps has a preference for working with tools and equipment. Someone who's social, on the other hand, likely enjoys working with other people, helping others, and is likely quite outgoing and extroverted by nature. So these are just a couple examples, but the whole goal of this assessment is to measure or assess an individual's work interests and determine how well those interests align with these different personality types, to determine the dominant personality type and in turn suitable work environments for the individual. And so the assessment itself comprises of about 72 items and can be administered by clinician or utilized as a self-assessment. At the end of the assessment, the user receives a three-letter code, which comprises of their top three personality types or top three dominant personality types, plus a list of possible career paths to explore. And so if we look at the picture on the right, this is a snapshot of my RIASEC. My code was ISC, which stands for Investigative, Social, and Conventional personality types, which are all reflected in the list of career options that are below. This is just a snippet of the options that were generated for me. It's pretty comprehensive and detailed. And if I were to go in and click on any one of these options, I would be provided with more information on the occupation, specific job duties, requirements, information on salary, etc. And so this can be a pretty useful tool when working with a client who perhaps is exploring new or different career paths and isn't sure of where they want to go. So in addition to the Holland Code, we have the Strong Interest Inventory. This assessment measures an individual's job interests, specific subject areas of interest, as well as preferred work activities, leisure activities, work preferences, things like leadership style, personal traits and characteristics, and their work style. The interest patterns are utilized using a RIASEC framework. So we're still looking at goodness of fit between an individual's personality type, their interests, and specific jobs, roles, or occupations. This inventory is or must be administered by a clinician, and it is proprietary. And so if you want to use it, you're going to have to buy it, and has about 291 items. Definitely one of the more lengthy ones in comparison to the RIASEC and the ONET interest profiler, which we'll get to in a minute. Speaking of which, the ONET interest profiler is a self-assessment that comprises of 60 items. In a very similar fashion to the RIASEC and the Strong Interest Inventory, has clients rate their interest in different job activities and then uses those interest patterns to match the client up with suitable career options or paths to explore. And again, we're using a RIASEC framework, so looking at how personality type, interest, align with different work environments and occupations. What's nice about the ONET interest profiler is that it's available online and it's free, and it's relatively shorter compared to the Strong Interest Inventory and the RIASEC. And so these three assessments are all useful tools when working with clients who are exploring new career paths or avenues. They're all united by a common theoretical foundation, and again is looking at goodness of fit between an individual's personality type, their interests, and different occupations and roles. Where they differ is in their length and their mode of administration.
So the next part of our presentation is going to cover population-specific considerations. So we're going to discuss the LGBTQIA+ community, disabled individuals, young adults and adolescents, older adults, and diverse and multilingual populations. So first, I'm going to discuss career counseling considerations and recommendations specific to the LGBTQIA+ community. So the first consideration is the presence of internalized homophobia. So this refers to the process where LGBTQIA+ individuals often adopt and subsequently internalize negative societal attitudes and biases regarding their community. This often leads to feelings of guilt and shame, as well as a negative self-perception. As a result, individuals who are part of the LGBTQIA plus community are likely to choose jobs that are less than their qualifications, jobs that don't align with their values and preferences, and are likely to have difficulty finding employment in general due to societal biases and discrimination. Um, there's a great deal of disparities in employment and income and socioeconomic status in the LGBTQIA plus community. Individuals in this community are more likely to find it difficult to find jobs, difficulty sustaining employment, difficulty finding a job that matches their income needs. The next consideration is identity confusion. So this refers to the phase of exploration around one's sexual orientation and identity. This is often accompanied by feelings of uncertainty and confusion around where the individual fits in relation to societal norms. At the workplace, this often leads to hiding their identity. And so I know we were talking in class a couple weeks ago about professional identity, and we really talked about how your identity as a person, while it might be different from how you present yourself in the workplace, those two things are often very related in terms of the core concepts that you present, that you put yourself out in the workplace, and that's really what how identity confusion can also play a role in here. And the next consideration is a lack of culturally competent interventions. So as we've known through other courses, there is a there are a lot of specific considerations for the LGBTQIA plus community, and in a lot of research that we see, there is not enough research in the LGBTQIA plus community for interventions, and looking at evidence-based practice interventions specifically that include participants who are in this community. Although we are making progress with that, there's still a lot of gaps in that, and so subsequently that is going to impact the interventions that we choose. So just when you are choosing interventions to apply to career counseling, which is already although there is a lot of research out there, it is a very understudied area as well. And so that research gap is going to be more pronounced. So that's just something to think about when you're choosing interventions, specifically emphasizing evidence-based interventions. And then there is also a great deal of lack of opportunities due to their actual and expressed identity, and this subsequently shapes their job choice. And as I was talking about previously, a couple sections ago, specifically around theories around self-actualization and efficacy expectations and how this plays into career counseling, these theories suggest that we choose jobs based on our values and who we are as a person. And if you choose a job that does not match with who you perceive yourself to be, then that is going to lead to negative impacts on wellness. And that could present as things such as depression, anxiety, other things as well. So with these considerations in mind, there's extensive research that suggests the following recommendations. So the first part is ensuring that as a clinician, you understand how discrimination against individuals in this community plays a role in job opportunities and choices for employment, as well as how the impact of shame and guilt and negative self-perception will play into this as well. And it's also important to understand how intersecting identities may play a role. So individuals who are of sexual and gender minority and who are also of another minority group, such as a racial or ethnic minority, are likely to experience compounding discrimination due to having intersecting identities. And as a clinician, it's really important to be aware of your biases around these populations and how this might impact the care that you provide. and how you can, when you're conceptualizing your client's case, and ensuring that you are also including in cultural conceptualization and how these intersecting roles are contributing to presenting problems, and how you can provide interventions that will help clients work through these. Um, and the next part, I did just kind of touch on this a little bit, but just again, ensuring that you are aware of any personal biases that you may experience yourself when you are providing care, and ensuring that you are seeking supervision for these things so that you do not harm the clients that you're supporting. Even if it's unintentional, sometimes biases come up and sometimes we don't even realize that we have them. And even though our intentions are often well intended for us who are working in this field, we still need to make sure that we're seeking supervision, working through those things, and becoming aware of those things. And the next part is choosing interventions to promote social support and advocacy. Um, there has been extensive research regarding career counseling in the LGBTQIA plus community that really emphasizes having goals around promoting social support and promoting advocacy in the client's life and providing them these skills. And also as a clinician, just ensuring that you are being an advocate for your clients as well, outside of your sessions, um, and promoting social support on a more systematic level, not just on an individual level when you're in the part that we are going to cover today are adolescents and young adults. The first consideration for career counseling for um, these individuals is the social cognitive model of self-efficacy. And this has been applied to career counseling for TAY is just transitional aged youth. So this covers clients who are aged 15 to 25. This suggests that, as I mentioned in previous slides, that self-efficacy and development predict career outcomes and post-secondary transition. So post-secondary transition, I mean the transition from high school to college, and as well as college to the workplace, and also for clients who do not choose to go to college, who might just go right into the workforce right after high school. And then at baseline, transitional aged youth tend to experience elevated levels of anxiety around career choice. And this anxiety is often exacerbated for clients who have pre-existing psychiatric diagnoses. Um, and so this could be anything such as anxiety, PTSD, depression. Just when you're conceptualizing your case and supporting clients, if you are using career counseling as an intervention, just conceptualizing this in there as well. And so choosing interventions that are compatible with that. Transitional aged youth with pre-existing psychiatric diagnoses, as well as exposure to adverse childhood experiences, often experience difficulty accessing vocational resources and often find it more difficult to obtain employment. Um, so, with that in mind, here are some recommendations from the literature. So supporting transitional age youth with selecting a field that is best aligned with their interest rather than focusing on what's more profitable or the most popular has often demonstrated optimal outcomes across multiple studies. So this kind of goes hand in hand with the social cognitive model of self-efficacy that was conceptualized by Bandura, this suggests that clients who are in this age group are more likely to have higher efficacy expectations around themselves as a person and as a professional, um, when they are choosing a job that is more aligned with their interests. And that's what this recommendation is really getting at. And then the next thing to consider is that depending on the setting, group career counseling for transitional age youth is equally as effective as individual. So this has really been demonstrated in residential settings, any settings where you might be working with children who are in child welfare custody. This would most likely apply to the 15 to 18 group age range. And school settings as well. Um, And the next recommendation is, as I was kind of talking a little bit about already, interventions utilizing Bandura's social cognitive theory, specifically around efficacy expectations to promote adaptive efficacy expectations, both generally and around work. Because if we focus on just one area of efficacy expectations, um, just focusing more on in general and in work is going to help promote more optimal outcomes in the long run. And then this final recommendation really touches on the third consideration around transitional aged youth with psychiatric diagnoses as well as exposure to ACEs. There has been some literature around the integration of trauma-informed practices for clients who have pre-existing psychiatric diagnoses and exposure to ACEs. One example that was in a case study in a study is developing a safety plan and coping strategies if a client begins to feel unsafe in the community, as well as integrating self-advocacy skills in the community while they're at work. Disabled individuals, like many other groups, often experience a great deal of disparities in their employment and their pay. They experience a lot of discrimination, they experience a lot of accessibility issues on a systematic level that prevents them from obtaining and maintaining employment. Individuals with neurodevelopmental and intellectual disabilities often benefit from additional supports such as job coaching, adult day programs focused on vocational opportunities, and supported employment. And while many disabled individuals are independent, there is a high prevalence of disabled individuals that have a caregiver or are under adult guardianship. Caregivers of disabled individuals in career counseling and counseling in general are often involved in the process and may benefit from additional supports themselves for things such as caregiver burnout and concerns with work-life balance. So moving on to the recommendations for career counseling specific to disabled individuals. The first and most important one is emphasizing advocacy, empowerment, and skill development. And this is for both professional and in general. Just really supporting clients with learning self-advocacy skills, focusing on interventions that are going to focus on empowerment, and focusing on developing coping skills as well as professional skills. This next part is that also, as we've seen with other populations, the social cognitive theory has also been applied to the disabled individual population and has been effective as well. Interventions consistent with this to promote efficacy expectations and core beliefs, both generally and regarding work, have been empirically validated by multiple studies. And we are going to have multiple studies listed on our handout. And the studies that are listed below are ones that have investigated this. The next recommendation is psychoeducation regarding legal protections and accommodations. So this is specific to accommodations such as IEPs, 504 plans, and the Americans with Disabilities Act. So there are a lot of disabled individuals who are strong advocates. It is still important to ensure that they are aware of their protections, and this is especially true if you're providing interventions around interpersonal effectiveness and self-advocacy, helping the clients really apply this to that. And then the next recommendation is psychoeducation and referral to external supports, such as supported employment and job coaching. There are a great deal of disabled individuals who benefit from having supported employment and job coaching. This is mostly specific to individuals who have a neurodevelopmental or intellectual disability. If you're unfamiliar with supported employment and job coaching, supported employment is often provided by, it can be provided by a state agency or a local agency such as a nonprofit. So supported employment provides classroom-based vocational coaching, and it supports clients with job skills from resume writing, interview skills, and applying job skills in the workplace. And job coaching is very helpful. These are individuals who will go to a job site with a client, and they will help them um, also with hiring as well. But there are job coaches that will be with an individual. This can be partially or completely during their shift, and supporting them while they're working in the workplace. And these services are extremely beneficial, and these are also extensively supported by literature. And in our resources section that we're going to discuss in a couple of slides, we are going to talk about some specific organizations within Massachusetts that provide these services and how you can help your clients get linked with these services. So as a clinician, it's really important to know the services that are in your local area that would be beneficial, and how you can refer clients to these supports. And then the next point is referral to services for caregivers. So this is for disabled clients who have a caregiver or are under adult guardianship. And then I did also want to touch on adult guardianship a little bit here. There are a great deal of individuals who have intellectual disabilities that are under adult guardianship. So this means that the individual has somebody who often makes legal decisions for them. So this could be either partial guardianship or full guardianship. And then that is another consideration for consent as well. Because if the individual is under full guardianship, it'll often be their adult guardian that is signing the consent forms and those types of things. So it's really important just to consider.
When it comes to working with older adults, there are a couple important things to keep in mind. So to start is the influence of negative age-based stereotypes on their employment prospects and the job seeking process. Older adults are more likely to experience age-based discrimination on the basis of stereotypes that relate to perceptions of being slower, less adept, less adaptable, less intelligent, which are enacted by employers. And this may all translate into hiring bias or reluctance or hesitancy on the part of an employer to hire or consider an older adult for a position. Hiring bias may also manifest due to fears that benefits may cost more for older adults, or that having an older adult in the workplace or workspace may be a liability, even though there's not much evidence to support either of these notions. Older adults may also experience a decline in physical and cognitive abilities due to natural aging process. These include reduced physical strength, slower speed of recall and processing, cognitive processing, which may limit the kinds of work activities that they can engage in, and by proxy, the kinds of career paths that they can explore. In addition to this, older adults may have certain skill sets that may not be particularly marketable given the current labor market due to developments and changes in technology. And so that's where the value of skill retraining and new skill acquisition really comes in. Even though that's really important, older adults may be resistant to acquiring new skills because doing so may take away from the security and stability of their current professional identity. In addition to this, the potential for workplace injuries and hazards is another thing to keep in mind. Workplace injuries among older adults are relatively uncommon, but when they do happen, tend to be more severe due to their age. And so again, from a safety perspective, just important to keep that in mind. And so in this context, here are a couple of recommendations when working with older adults. For the clinician, it may be helpful to assist the client in developing an understanding of their personality style, as well as their career values and goals, in addition to preferred or suitable work activities. When seeking a job, it will be important to emphasize communication of the client's valuable attributes to an employer, given the prevalence of age-based discrimination and the strength of those associated stereotypes. In a related vein, it may also be helpful to examine how the client's own biases or self stigma may affect how they're engaging with the career counseling and career development process. Those same stereotypes that are enacted by employers may be to an extent internalized by the client and affect how they are engaging with the overall process. As I mentioned earlier, the value of retraining and new skill acquisition is something important to convey to a client and may be necessary to educate them on why skill retraining and acquisition is required and encourage them to pursue or develop skills in areas that are currently in demand to make them more hireable, more marketable. And finally, it's important to cultivate an awareness of the client's own limitations and abilities so that they're making realistic choices when it comes to career pursuit and exploration, as well as safe choices. When working with clients from diverse cultural backgrounds, some of these considerations, recommendations may be more general, more broad in nature, such as the ones I'm going to be discussing here. But there may also be things to keep in mind that are more specific to their or to the client's background. And so when working with such clients, this may warrant further or additional research. But nonetheless, it's important to cultivate an awareness of how a client's culture may shape their career goals, interests, and aspirations. One example of this is cultural values. For example, being more individualistically versus collectivistically oriented. In individualistic cultures, research suggests that personal interest is a better predictor of job satisfaction and career decision making. But this is not the case in collectivistically oriented cultures. In these cultures, decision making has more to do with how career choices are going to affect the larger group or collective, as there is a sense of needing to assure or being responsible for ensuring the well being of the larger group. And so a client may bring this into the career counseling space. And so it's necessary to, one, have a sense of what influences are shaping the career development process and what the strongest ones are. Individuals of ethnic and racial minority backgrounds may also experience discrimination or racism in the workplace. This can take the form of implicit discrimination, for example, microaggressions, explicitly enacted discrimination or racism, as well as anticipatory discrimination, in that an individual expects or anticipates being discriminated against, and as a consequence, does not pursue or seek out certain career opportunities for fear of that. Research does suggest that individuals of ethnic and racial minority backgrounds perceive experiencing discrimination in the workplace to a greater extent as compared to their white counterparts, with rates being as high as 60% according to one study. It is important to note here that this research was conducted with a sample that was not only of an ethnic or racial minority background, but also was older in age. And so here we see how clients' intersecting identities can really shape their experience in the work sphere. And so again, having an awareness of this intersectionality is really key as a clinician when guiding a client through career exploration. Finally, we have degree of acculturation as a strong shaping influence on the career development process. Here, the research is limited and tends to focus more so on populations of Hispanic or Latin American origin, as well as Asian American populations. But nonetheless, there is some evidence to suggest that a greater degree of acculturation or assimilation to the mainstream culture is associated with higher educational aspirations and expectations, as well as greater endorsement of career interests that are typical of the mainstream culture. And in fact, these more acculturated individuals not only endorse more interests that are typical of the mainstream culture, but also often go on to work in interest congruent fields or occupations. So moving on to some recommendations for working with culturally diverse clients, it's important to be creating a safe environment in which to discuss any experiences of work-related racism or discrimination and how the client perceives these experiences as having shaped their career development process. It also may be helpful to identify strategies and supports to buffer against the effects of work-related discrimination, and, as I mentioned earlier, develop an understanding or conceptualization of cultural factors that have a bearing on the career development process. These can include things such as cultural values, norms, expectations, gender role messaging, and familial expectations. And finally, fostering a space in which to have discussions on other things that the client may perceive as barriers to career development and advancement may be another worthwhile endeavor. So moving on to resources for clients and clinicians, here are a couple of general resources that may be helpful when assisting a client in career exploration or even for the client's independent use. And so to start, we have ONET Online, which offers occupation-specific information on things like job duties, job activities, educational requirements, useful or required skills, and the work environment. There's also some information available on worker characteristics, things like worker values, worker work style, and work preferences that may assist the client in determining goodness of fit between their personality, interests, abilities, and the work environment. Other information available on ONET Online includes info on employment trends, on salary, as well as the ability to search for available job positions at the local and state level. The National Career Development Association, or NCDA, is a very similar resource to ONET Online, but it organizes itself a little bit differently. It provides users with tools on self-assessment to help identify career interests, as well as an extensive list of career exploration search engines. So things like Indeed or ZipRecruiter in case someone doesn't even know where to start with a job hunt. There's also an exhaustive list of profession-specific websites available with more detailed information on different occupations, things like work requirements, educational requirements, work duties, and salary. Other tools include educational resources to help advance skill sets, things like MOOC courses, information on employment trends and employment projections, as well as resources that cater to specific populations, such as formerly incarcerated individuals and veterans. The NCDA also does offer some resources on developing skills that are relevant to the job search process or the career counseling process as a whole, including how to write a resume and how to sit for an interview. USA Jobs is another good resource. It's a little bit more niche in comparison to ONET Online and the NCDA because this caters specifically to people who are looking for a job in the civil service. So if you're interested in looking or working for the government, this may be a good place to start. It provides individuals with information on available jobs, job opportunities, as well as job-specific information, including work duties, requirements, and salary.
Very highly recommended to research the different supports and resources that are available for your clients in your local area. But this is just a list of resources that are applicable to Massachusetts. So in Massachusetts, there are currently what is known as mass hire centers. So these are centers that help provide job entry services. So this is an emphasis on soft skills. So this and also things such as interviewing and resume writing. Mass hire centers also regularly put on job fairs. And then there's also another part that is called reemployment services and eligibility assessment. So this is very helpful for clients who might have been out of work for a little bit and they're looking to get back into the workforce. This can help them with that transition. And the next part is Massability. Previously, for anyone who's familiar with this resource, this was previously known as the Massachusetts Rehabilitation Commission. This department is something that provides various resources, but specific to vocational, this often provides supports vocational supports to individuals with disabilities and severe psychiatric disorders. So this can help provide services like a job coach, supported employment, those things. This often does require assessment through like psychological assessments and testing be disclosed to determine eligibility for services, and that is something that is really important to note if you are referring clients to the service. Working in residential for my internship and also currently working as a case manager at a special ed program, this is a resource that I have personally found very helpful for my clients, as well as their families. But there are a lot of confidentiality considerations for this as well, and there is the requirement of disclosure of certain information to determine eligibility for services. So that is something just to keep in mind for this resource. And then next I'm going to discuss some different areas that provide specific vocational services. This also includes career counseling. If this is a area that you do find yourself interested in, where can you work? This is again just applied to Massachusetts, but also if you are not interested in pursuing this field, where you might be able to refer clients that you believe career counseling might be beneficial, and also for things such as job coaching, supported employment. So the first reason their Aspire program, they provide both job coaching and career counseling, and they also have career opportunities in the area if this is something that you are interested in. The next one is Advocates. Advocates has more focuses on job coaching and supported employment. Open Sky Community Services also has some opportunities in job coaching, career counseling. This is more specifically in the residential area, but there is also, you can receive these services on an outpatient basis as well. And then there is another program called the ARC. This also provides supports to help link with services such as Mass Rehab Commission / Mass Ability and other similar resources. And then Justice Resource Institute has a specific program called Strive, which is based out of Boston. And then finally, I am going to talk about the impact of legislation on supports and resources. So there has been a lot of legislation passed very recently that will impact funding and resources. Medicaid cuts are limiting the availability of a lot of these services to clients, and this is going to continue over the next few years as well, unfortunately. These services, as we've talked about, have been extensively validated by research and have been shown to be extremely effective in research and out in the community as well, and coming from many client voices as well. Many service providers receive funding that has been cut, and this is going to lead to a lower availability of these services. So what do we recommend as a clinician and as for a client? As a clinician, it's really important for you to stay knowledgeable about legislation and how this may play a role into the services you provide, as well as the services that you recommend to clients. When you refer clients to certain services, first, if that's something that collaboratively you decide is a best approach, it is important to make sure that those services that you're referring them to are ones that they're going to benefit from and services that they're eligible for, and that so just wanting to keep that in mind. And then also supporting clients with evidence-based interventions for managing stressors that may arise as a result. There's going to be a lot of stressors that come up out of recent legislation and a lot of services being cut. And it's really important to keep that in mind, working with clients and how you can support clients with working through this. So thank you guys for listening. We appreciate it. And